right. So I invited a veterinarian that has worked a lot on my own horse, Dr. Paige Billek. She now owns Integrative Equine Performance Medicine, her own practice, which is a complementary therapy, sports medicine, and rehab ambulatory practice in Northern Illinois. She holds a lot of certifications, which is what she's going to talk about tonight: veterinary acupuncture, veterinary medical manipulation, and equine rehabilitation. Her practice is centered around working with each horse's care team to help them feel and perform their best by taking a whole horse integrated approach. And when she isn't working, and this was a surprise to me, I didn't know this, you can find her on or next to the polo field. Dr. Billek, I will pass it over to you now. Take it away.
Perfect. So like Lydia and Molly both said, we're doing things a little bit differently tonight. I've obviously not been involved in your other meetings, but I'm fairly casual. So I find that I get more from stuff like this if it's a little bit more of a conversation. So if you have any questions at any point, go ahead and unmute yourself and ask.
Paige, do you, or Dr. Billek, do you want people to put themselves on video so you have some faces to look at besides Molly and me?
I mean, I would be totally fine with that. I don't want to pressure anyone into anything, but yeah, like really, I want this to be what you guys want it to be. So I have stuff prepared. We'll definitely get through it, but there should be plenty of time for questions. And I find that normally if one person has a question, probably 3 other people do too. So don't hesitate.
And I hate to keep interrupting you, and I just want to let you start, but Molly, did you say anything about capturing email addresses so we can send the handout? Okay, you're on mute. You're on mute.
So if you would like to have that, there's some presentation materials that Paige has that we can send to you after the session. If you'd like to get the materials, please put your email address in the chat and I'll pick it up at the end of the program. Thank you.
Perfect. So like Lydia said, I graduated from Iowa State. Then I worked at Fox Valley Equine practice for a couple of years and started my own practice centered around sports medicine and complementary therapies. So that's all I do every day. So what I'll talk to you guys about today mostly is medical manipulation and acupuncture. We can talk about other things if something else comes up for sure. But what I thought I would do is kind of go through what each of these modalities is, kind of how it works. Could your horse benefit? We'll talk about conditions that these treat successfully and well, and then we'll kind of go through what to expect as far as the treatment goes. I'll talk a little bit in generalities and much more specifically about what I do. So medical manipulation is another name for chiropractic. As a veterinarian, we actually can't say that we're chiropractors or that we're doing chiropractic adjustments because that's a protected term for humans. And when I say protected for humans, I mean protected for human chiropractors. Only people that have gone to human chiropractic school and are essentially doctors of chiropractic can call themselves chiropractors. So us vets use the term medical manipulation or spinal manipulation or something to that effect. Now there is an animal chiropractic association that we can be members of, but again, you still can't call yourself a chiropractor. So it's kind of just a nuance, but veterinary medical manipulation is chiropractic for animals. And the way it works is, I have a lot of clients that will say, oh, this bone was out of alignment or out of adjustment the last time the chiropractor came. The bones aren't actually going out anywhere. Each bone has to stay kind of in its normal sequence and normal space within the body and especially the spine, or else you'll have a severed spinal cord. So the bones aren't going out anywhere. They're just becoming restricted kind of at the far end of their range of motion. So that's kind of a soapboxy thing, but it's something that I hear all the time. And I think that if you are imagining a bone being out and putting it back, that sounds almost impossible, especially given the size of the horse. If you think of it being restricted and easing that restriction, that makes it a little bit more easy to picture what we're actually doing. So essentially, it's a whole body approach to improving the health and movement of a horse. So normally we assess the posture, gait, and overall comfort of the horse, and then do a specific hands-on palpation to look for pain in the muscles, tendons, joints, or bone. Each joint is assessed, like I said, for the normal range of motion. So we know that each joint and each bone in the body only has a certain degree that it can move normally, back and forth, kind of through the normal range of motion. Again, if we notice restricted range of motion, that's when we make the adjustment. So we're restoring the range of motion, not the location of the bone. To restore that range of motion, we normally do what's called a high velocity, low amplitude thrust. So we're not trying to generate a lot of force with the adjustment, but we are trying to make the adjustment of one specific bone or joint at a time, and specifically in the line that joint normally moves, and very quickly. The quick part is important because essentially we want to make the adjustment quicker than the body can tense up. If you think about yourself at the chiropractor, if you know that your neck is going to be adjusted and start getting tense through your muscles or whatever, then the adjustment's a little bit harder to make. So we try to make that a high velocity or a quick thrust to prevent the muscle from tensing up and actually preventing the adjustment, since horses are so big and their muscles are so strong. So as I kind of alluded to, you have to make the adjustment within the line of motion of the joint. So you might see some people standing on a ladder or a bale to be above the horse to be in line with the joint. What I do sometimes is, I know it sounds a little bit funny, but use rubber mallets to allow me to stand on the ground and have the correct line of motion by reaching essentially with the mallets above my head to have the right line on the joint. So that's really important, that you're trying to move the bone in the direction that it normally moves. If not, obviously you're not achieving anything, but you're also creating pain. So essentially, once we restore this range of motion, one, you're allowing that joint to move better and move more freely. But two, you're also decreasing pain and muscle spasm, and helping the nervous system work at a higher capacity. So if you think about it, the spine goes through the spinal cord goes through the spine, and from the spinal cord, you have nerves that come off that go to different parts of the body. Some of those nerves are used essentially for pain in the back or the haunches or whatever. Others of those nerves go to the stomach to help with digestion, or the bladder to help with urination. So if those nerves are pulled on, essentially by the vertebrae being kind of restricted to the far end of its range of motion, you're actually hindering the nervous system a little bit. So one, you're decreasing pain and muscle spasm, but two, you're actually helping to modulate the nervous system on a more holistic scale to help the horse's digestive system work better, or to help again with urination or defecation or what have you. That's kind of a really brief overview. Does anyone have a question at this point? Okay, cool. So the question that people always say is, okay, could my horse benefit from medical manipulation or chiropractic or whatever you want to call it? And in general, the answer is normally yes. I find that most horses benefit, if not from kind of a treatment perspective, from a maintenance perspective, in order to help perform at and feel their best. So some signs that your horse might need an adjustment would include, and these are things I hear all the time, difficulty picking up canter, difficulty maintaining a canter, difficulty with leads in one direction or the other. I see a lot of horses with stiff necks. So kind of a resistance in one rein is something that I hear about all the time. Or riding with their head tilted, or lunging with their head tilted in one direction or another. Or tossing their head under saddle, or just when you're bridling, actually. One of my horses, like Lydia mentioned, play polo. And one of my horses I bought because I thought I could fix her neck. I rode her for a season, Esta Lise, and she always tilted her head to the side, no matter what you did. And at the end of the season, I said, hey, so I think I can fix this horse, but like, we've already negotiated a price. So like, the price is the price, right? And they're like, yeah, no, and for sure you can't fix the horse. Anyways, she's straight now. So, but honestly, like, many people had ridden this horse and tried to figure out what was wrong with her and why she would only turn left. And she'd been muted and abandoned in the whole 9 yards. And one chiropractic adjustment, and she's totally quote unquote normal. But I do know when she needs adjustment again, because she won't let me put her bridle over her right ear. So
now I
that's-
have a question, Paige. Dr.
Yeah.
Billek. Did you just say that one chiropractic treatment and she was better?
Like, yeah, like perfect, honestly.
Okay. Well, then one of the things I struggle with chiropractic is knowing how many appointments or visits it's going to take. Like, what should the horse's response be? Should they be perfect after the first one, and if they're not, then it wasn't the right modality? Or is it something that's going to get little by little better and better over a year? Because I look at when I go get body work done, I'm not perfect after it. So I'm like, what should I expect when my
Sure.
horse is done?
So that's a great question, and it really depends case by case on the horse. That's a really interesting example, because it really was one adjustment, and she literally, like I said, sometimes she gets sensitive again, and I adjust her again. She's great, but after the first adjustment, it made a very significant difference that I noticed and everybody else noticed. But I would say, as a rule of thumb, if I'm treating something, like if someone's calling me out because their horse won't pick up a lead, or won't turn one way, or is ducking out of jumps or whatever, I normally expect to see, I would say, about a 50% improvement after a couple weeks. So I say after a couple weeks because the body's been probably compensating with whatever that adjustment's been for a while. So as much as we have addressed the restricted motion and kind of gotten things back on the right track, in a lot of ways, a lot of the horses have to kind of almost relearn how to move without that restriction pattern or without that compensation pattern. So the first week or so is kind of a rediscovery. The second week is a little bit more building that appropriate muscle memory a little bit. And then after that, you should see a pretty significant improvement. Normally, I would say with chiropractic, especially, to give it 2 treatments to see if your horse responds. Normally what I do is see a horse and then plan on coming back initially 4 to 6 weeks later if we're treating that issue, a known problem. And normally people will tell me, oh yeah, they were doing really quite good for the first 3 weeks, and then we kind of noticed a relapse, and now you're back to kind of tune things up again. And then I typically spread the appointments out a little bit further. A lot of the sport horses I'm seeing every 8 weeks. At minimum, if I have my choice, I prefer to see most patients at least every 12 weeks. And that's a little bit based on my mindset, which is I'd rather look at the chiropractic or the medical manipulation as a kind of long-term preventative program versus a treatment. Yes, it can treat things like I mentioned with my horse where she, didn't want to turn in one direction. But as long as you kind of stay up on that stuff, even if it is just 4 times a year, I find that there's less complaints when I see people, the horses seem happier, the muscle that they develop is more appropriate, and their muscle memory is more appropriate. So 1, they're more comfortable, 2, they're performing better, and 3, we're seeing less performance issues and less soundness issues with the horses that we're seeing frequently. I don't know if that totally answers your question, but yeah. Perfect. So
We got a barking dog, and the only person not muted is Paige and Lynn Crivello.
Oh,
So
okay.
I'm gonna guess it's Lynn Crivello.
okay. Any other questions right now? Okay. So other conditions that I find that I treat a lot. Actually, this applies a little bit more to normally the older, more geriatric horse. I see a lot of horses that either can't lay down or can't get back up if they lay down, which again may not necessarily apply to your sport horses, but makes a huge difference in some of them as they age. And another complaint that I hear all the time is horses that are resting their hind end against the wall or breaking the water buckets off the wall, resting their butt. Those guys really benefit from chiropractic because they tend to have significant pain in their lumbar spine, which is normally why they're resting. Another interesting one that isn't always a chiropractic issue, but can be, is if a horse is kind of always pointing with one front foot forward. Now that can also be a lameness issue if your horse is, always pointing with the left front while they're standing, for example. That normally means they're trying to take pressure off the left front, which could be a sign of coffin joint arthritis or navicular or what have you, but can also be a sign of a chiropractic restriction, or it can be a sign of both. Your horse or a horse could be sore in the lower limb, standing that way to compensate, and then end up with significant soreness through the base of their neck or their shoulder, especially. And then you have kind of a chicken and egg situation where you have to, 1, address the lower limb, and 2, address the shoulder and the base of the neck. Actually, I see a fair number of horses that were treated for abscesses, that like abscesses in their hoofs, that end up being really, really sore kind of through the shoulder because, as you may know, the horse actually doesn't have a bony attachment from their shoulder to their body. So the whole forearm is actually just attached via muscle. So if you think about it, if the horse is sensitive on the foot and not trying to weight it, they're using the shoulder muscles to lift up this way to prevent the weight from going on their foot, and they end up fairly stiff and restricted from that. Another thing that people don't think about a lot is muscle tension lines, which means pretty much nothing if you can't picture it, but especially through the neck, if you think about those horses where you feel like you can actually see lines on their neck where every vertebrae is. And at the end, I can pull up a picture of that off of YouTube or something. But you can actually see where each vertebrae is. That means that there's significant muscle tension in the neck. You normally should be able to see kind of a smooth outline, or maybe a couple of ridges of the vertebrae, but you don't actually want to see every outline. So another one, kicking or bucking under saddle, or girthiness when the saddle is put on. Obviously, those are signs that could correlate with pretty much anything. Kissing spine or ulcers also come to mind, but I have a lot of horses that we rule out the other two, and the chiropractic adjustment stops the behavior. Actually, interestingly enough, recently I saw a horse that had kissing spine surgery, and we were working with her to essentially rehab post-surgically, and she was doing fantastic. Actually had less pain than I'd ever seen post-surgically, and we were about 3 months out. So she was back to doing some light work, back under saddle. And the first time I evaluated her, I said, oh, hey, she has some restrictions through her lumbar spine. Let's think about either having me adjust her or have someone else adjust her. It doesn't matter. And then work on these exercises. Essentially, I was a rehab consultant. I wasn't her normal vet. So I didn't want to step on anyone's toes. Long story short, we saw the horse probably 90 days after surgery, another month later, and it was the same thing. The horse was doing great overall, but still had those restrictions in the back. And then I said the same thing. Hey, somebody should adjust the horse. Came back another month later with the note on my schedule that the horse needed a gastroscope and was bucking and rearing under saddle, which was like a 180 from the horse that I'd seen 30 days before. So we put the horse on a lunge line. She moved fine. We put the rider on, who's actually quite a good rider, and cantering only to the right. She was resistant to move forward, kicking out, rearing, was actually even reluctant to pick up the canter. To the left, she was a little bit reluctant, but moved much better. But to the right, she was like fairly explosive. And I asked the rider, just as an experiment, to step hard into the right stirrup in a 2-point and essentially get off of the left side of the horse's back where I knew that it had those chiropractic restrictions, and had her walk trot and canter trot transition. And the horse didn't kick out once, didn't buck once, moved forward readily. I had her then sit back down in the saddle and step hard into the left stirrup, and all the behaviors resumed. So essentially, like, the horse that they thought had ulcers or was regressing after the kissing spine surgery truly just had tension kind of under the left side of the seat from these long-lasting chiropractic restrictions. So we went ahead and adjusted the horse, and she did pretty good for 4 weeks, ended up going back and doing like a trigger point therapy to the back too, just to take away any lasting pain. But that's kind of a good one to show that, yeah, I mean, the girthiness, the kicking, it can be ulcers, it can be kissing spine, it can be whatever, but sometimes it truly is just a horse that's really sensitive to their body and chiropractic restrictions.
That story makes me think of 2 questions. One is, after you work on a horse, you put your hands on him and you see what issues is going on and you do your thing. Do you often leave the owners with some homework or physical therapy that they're supposed to do, walk over poles or pull on the tail or something? And then do you manipulate other tissues besides the bone and joints if you feel restrictions or tension or pain or tightness or something?
It's like, you know exactly where I'm going with this. So yes, the short answer is yes. So for me, and yeah, we can do it this way. I'll tell you guys a little bit about how I look at most cases to answer both of Lydia's questions, which is, will get us a little bit into acupuncture, but I think we'll still have a fine flow. So for me, the first thing I do when I see a horse is watch it walk. Now, if there's a complaint of lameness, then obviously I watch it trot or watch it under saddle or at the canter. But for me, the walk is the best to assess essentially asymmetry that's associated with chiropractic restrictions. So I have every horse walk toward me and away from me, and what I'm looking for is any asymmetry in their movement. At the walk, they should be fairly symmetrical. They shouldn't be twisting a lot in one hind fetlock and not the other. They shouldn't be twisting a lot in either hind fetlock truly, but and they should track symmetrically with their their hind feet underneath them. They shouldn't be having a huge drop at the side of the pelvis in one direction or another. Their head should move fluidly at the walk. And actually, if you watch a horse walking, their nose should make a little bit of a figure eight. Their neck should kind of swing both ways, and actually does make a figure eight pattern normally. So that's what I do first. From there, I put my hands on the horse and normally just do a really general feel for, okay, is there any heat? Is there any obvious swelling? Especially through the back, am I feeling any areas of atrophy or essentially decreased muscle development? Or are any of the muscles significantly tight or tense? Am I feeling any obvious like knots or muscle trigger points? And that kind of lets me know a little bit what I'll be seeing with the horse. From there, I do more of a bony palpation. So we call it a motion palpation. I use one hand to essentially touch the dorsal spinous process, or the part of the vertebrae that sticks out along the back. Or if you run your hand down your back, down the middle, what you're feeling as the dorsal spinous process is the same as the horse's. So I use 2 fingers this way to put them around the dorsal spinous process, and then use the other hand to essentially wiggle the horse from the tail. And I should feel each vertebrae moving toward me and away from me. If I don't, that's where the restricted motion comes in. So that's where I'll end up making the adjustment. But I go through and do kind of a really brief palpation again, just to get an idea of what's going on. And then I do what's called a diagnostic acupuncture point scan. So I'll run the edge of a needle cap along the meridians where acupuncture points are, and look for areas of sensitivity. And the really nice thing about the scan is it gives you an idea of local sensitivity. So sure, if I run the needle down, or the needle cap down the horse's back, and every point there is sensitive, then yeah, the horse likely has back pain. However, the diagnostic acupuncture point scan also works using referred pain. So there's points near the jaw or under the abdomen or kind of right behind the saddle area that would be suggestive of stomach ulcers, or points on the neck that suggest knee pain, or points behind the shoulder that suggest foot pain. So one, it helps me get an idea of what I'll see kind of chiropractically and what acupuncture points I need to treat. But 2, it also helps me say, hey, has this horse had its ox injected in a while? Yeah, especially in the case of performance horses, maybe we're starting to get a little bit of soreness here. And I know that because of the acupuncture point scan. So I find that it helps me kind of screen for issues, sometimes even before they become issues. So from there, I'll do acupuncture. And on most horses that I'm seeing kind of frequently for musculoskeletal issues, I do what's called aqua acupuncture. So I'll inject a little bit of vitamin B12 into the acupuncture point. And I like that technique for a couple of reasons. One, it works very quickly, essentially stimulating the point by the insertion of the needle, and then the pressure of the injection of actually pushing something through the needle. And then third, by leaving a little bit of that B12 in that spot to kind of continuously stimulate the point. So it gives a little bit of a longer lasting acupuncture, essentially treatment. And I do the acupuncture treatment before the chiropractic to, as Lydia alluded to, address the other tissues. So for me, I'm really trying to make the treatment totally inclusive. So I find that using the acupuncture to relax the muscles ahead of the adjustment, 1, makes the adjustment last longer and work better, and 2, it's very rare that I have a horse that's sensitive or sore after an adjustment, because again, we've really worked hard to relax those muscles before I'm making any adjustments. And so normally on most horses, I'm using a lot of points kind of in the neck, shoulder, and back and haunches area, typically. And again, we'll kind of discuss different nuances of acupuncture as we go a little bit further, but that's normally what I do. From there, I do the adjustment, and it doesn't actually matter how you do this, but I always do it in the same order to make sure that I'm not missing anything. So I tend to start with the spine, then come back through and check the ribs, then go back to the hind end, hind legs, front legs, and neck. Truly, it doesn't matter. That's just how I've always done it. After I've essentially done all of the bony adjustments, then I come back through and look for any remaining trigger points in the muscle or knots, anything that feels to me like a mild fascial restriction. For those of you that don't know, fascia is actually really interesting. It's connective tissue in the body that essentially goes around everything. So like there's big kind of sheets of fascia that would go around each muscle, but it's the smallest going around each nerve or each muscle fiber. So now if you look, a lot of people are calling fascia one of the biggest organ systems in the body, and it actually has some kind of transporting molecules and communication too, but kind of for our purposes, it's the wrapper that goes around the muscle and between the muscle and the skin. So if I feel any knots or any restrictions within the fascia, I try to massage them out as much as I can with some trigger point release techniques, and then actually go and stretch the horse according to the restrictions that it had. So the best way to kind of relieve that muscular compensation pattern that the horse has developed is, one, taking away the restrictions, two, addressing any pain or soreness in the muscle or spasms, and then three, actually kind of resetting the muscle stretch receptors. So I do that by essentially stretching. So if I'm doing an adjustment, it's really common for me to ask the horse to do a butt tuck, kind of where you scratch at the tail head and ask them to lift their back and hold for 30 seconds, and the same kind of side to side. I want to put their spine, especially through a full range of motion. One, to stretch out the muscles, but two, to actually kind of reset the nervous system. So I mentioned earlier that the muscle or the nerves have a pull on them if the vertebrae is restricted. I'm showing the horse, the nervous system, essentially that, okay, those restrictions are gone now, so it can fire a little bit more freely. And I do some balance exercises too to kind of help with the same thing. I rock the horse back and forth, I lift the legs, and help kind of reset the nervous system without the restrictions that the horse previously had. And then I definitely leave the owners with homework or physical therapy exercises. So normally a handful under saddle, sometimes the simplest, start the horse to the right because their compensation pattern essentially needs to be strengthened in that direction, or ground pulls or other exercises in hand. And then I normally have a few exercises for people to do following their ride. And normally those are kind of the long stretches, like stretching a leg forward or backward or what have you. And an important point is, I know a lot of us kind of learned growing up to do those stretches where you stretch the front leg out in front of the horse and hold for 30 seconds before riding. We actually really want to only do that after riding. And the reason for that is when you do those like prolonged stretches, you're actually resetting the muscle fibers, like the stretch receptors within the muscle fibers, to a longer length. So if you think about it with yourself, if you try to touch your toes once and wait for 30 seconds, maybe the first time you only get to your knees or your ankles or whatever. But if you repeated that again after 2 minutes, you'd probably be able to stretch a significant amount further, which is great. That's the idea of the stretch. You're resetting those stretch receptors to a longer length. However, you don't want to do that on yourself or a horse before exercise, because now that you've reset those receptors to a longer length, you don't actually pick up on the differences of footing as quickly. So essentially, if your muscle's already stretched to a longer length, it won't send a signal to your brain fast enough to say, okay, now you're on uneven footing. And in humans, you're more likely to like sprain an ankle or something that way. The same thing in a horse. If you're resetting those receptors to a longer length, they'll actually be more likely to trip or become injured because of that. So that's something that is a misconception that I think we have, that we should do the stretches before. Actually do the stretches after. They'll be better stretches because the horse is warm and you're not risking injury. Very rarely will I have an owner do something before riding, and normally that homework would be to either put a warm heating pad on the back, or even use like a vibrating massager before riding to relax the back a little bit in horses that are really, really tense. And it doesn't sound like it would make a big difference, but on some horses it makes a huge difference to kind of warm them up before you get going. I also have clients do balance exercises. As I'm doing my adjustment, I'm looking for any like restricted balance patterns. So on your own horses, go ahead and look. When you lift up a front leg, are they lifting the opposite hind leg at the same time? Or when you put down their front leg, are they popping off a hind foot? You know, the horse really should be able to lift each of its feet independently of moving its body. Like they should just truly be able to pick up a foot. However, I see most horses, if you ask them to pick up the foot, either have to shift a step over to the opposite side or are picking up a hind leg. And those are all signs of kind of compensation patterns within the horse. So we want to essentially treat what's going on. You know, we want to find the restrictions, but we also want to treat the whole body and treat any compensations that the horse developed because of those chiropractic restrictions. So that's kind of a really long answer to Lydia's question. But I find that the stretching, the physical therapy stuff makes a huge difference. I have some barns where the horses are in a training program, and like in a full service training program with 80 other horses, and those horses for sure don't get the physical therapy or the stretching. And those are the horses that I, you know, see every 4 to 8 weeks, and they have almost the same pattern of restriction that they did 4 to 8 weeks beforehand, because nothing's changing in their riding, nothing's changing in their program. So essentially they're just keeping the same compensation, which then leads to the same restrictions. And you know, we maintain them, but we're not actually solving anything long term, versus horses that I see that the owners are completely diligent with the stretching. We're really on a maintenance program then. And you know, normally there's still something to be adjusted or something to be discussed. But those horses are normally doing much better, not having the same complaints. That was a lot. Any questions? Okay. So we really covered most of medical manipulation or chiropractic. We can definitely go back to it if anyone has any questions as we go. But now we'll get into some of the more specifics on acupuncture. So acupuncture is essentially a holistic approach to wellness and treatment of disease, obviously involving stimulation of acupuncture points. And there's kind of two very opposing schools of thought on how acupuncture works. You have kind of the Western medicine perspective, which is that acupuncture points are actually along the points of, or the path of large nerves in the body. And by stimulating the acupuncture points, again, whether that be with the insertion of the needle or injection or laser, whatever, that causes the nerves to actually send a faster signal to the brain than the nerves would send for pain. So the theory there is actually called the pain gate theory, which is really interesting because we've been able to prove that by stimulating an acupuncture point, you send a faster signal on the nerve to the brain than the signal that essentially travels for chronic pain, which is a slower signal. So your signal for essentially the acupuncture point or a good feeling or pain relief or however you want to think about it gets to the brain faster, and the brain can only interpret one signal from that area. So you're essentially beating out the pain signal and preventing pain that way. So that's one kind of Western medicine theory, which we've proven for acupuncture. It also increases circulation, increases stem cell production, and increases endorphin release. And endorphins are those feel-good hormones. Those are all like medically proven acupuncture, essentially. Geez, that the word is escaping me. Sorry. Yeah. So that's what happens.
Modality?
Yes, thank you.
Okay.
Geez, one of those days, I guess. So essentially, those are all causes or all effects of acupuncture. So ultimately, you're helping treat pain and stimulate the body to heal itself with the nerve function there, and then increasing circulation, increasing stem cell production, and the endorphin release. The really interesting thing is we've done some studies to prove that because you're stimulating circulation by stimulating acupuncture points, you're actually increasing the amount of, like if you're giving a systemic medication and using acupuncture, you can increase the amount of systemic medication that goes to a specific area by using acupuncture. It also is something because of that increased stem cell production that would be beneficial to do before you're harvesting stem cells or doing something like PRP or Prostride or whatever. So that's fairly interesting. From a traditional Chinese medicine standpoint, which is kind of the other way to look at acupuncture, the acupuncture points are seen as specific points on the meridians. Meridians are essentially the channels with that energy flows in, energy or qi in Chinese medicine. And essentially in Chinese medicine theory, illness or pain occurs when the energy flow is disrupted in one way. So it can be kind of stuck energy, it can be too much energy, or it can be not enough energy. And essentially the idea behind an acupuncture treatment then would be to restore harmony within that energy flow and decrease pain and cure illness. And then the idea there is that regular acupuncture treatments can prevent disease. For me, I try to blend the two ideas. You know, knowing where those nerves are in relation to the acupuncture points does definitely help with treatment of certain conditions, but sometimes taking a little bit of a broader approach and looking at that Chinese medicine kind of diagnosis helps us make sense of things that maybe we really couldn't make sense of in Western medicine. That's a little bit abstract. Does anybody have any questions? Okay. So things that I use acupuncture as a treatment for, you know, I already really alluded to that kind of musculoskeletal idea for pain or dysfunction. It's really successful in treating things like muscle pain, joint pain, arthritis, tendon and ligament injuries, or laminitis. It also is really good for treating nerve dysfunction because of again, knowing that the acupuncture points are along that pathway of nerves. So things like facial nerve paralysis or Sweeney, which is essentially a paralysis near the shoulder, or atrophy from lack of use or injury. Normally in those cases with nerve dysfunction, we'll use a technique that's called electroacupuncture, where we insert an acupuncture needle and then connect another, or use an electric lead to connect two acupuncture points essentially, and then turn on the electric, and it essentially sends a path from the one needle to the next. And if we stimulate that path along the path of the nerve, we're helping kind of wake that nerve up a little bit, especially in the case of facial nerve paralysis. Acupuncture can also be used for a lot of internal medicine conditions. So things like heaves or anhidrosis, which is non-sweating, diarrhea, skin issues, Lyme disease, EPM, chronic colic, ulcers, Cushing's disease, infertility. Those are things that I've treated with successfully using acupuncture, and behavioral issues. So things like anxiety, fear issues, biting, kicking. I have a horse that I see pretty routinely who, prior to his acupuncture treatments, was very herd bound. And we had tried kind of everything up to acupuncture, and acupuncture was the thing that kind of pushed him over the edge, and now he can go trail riding by himself, and leave the herd and not have any issues. The interesting thing about acupuncture, especially if you're looking from the Chinese medicine perspective, and the reason why it can be used to treat all of these conditions, is because you're not necessarily only treating the symptom. You're trying to look a little bit deeper at the root cause. And when I say that, when we make this Chinese medicine diagnosis, we're essentially kind of looking again at a different way than Western medicine. So it gives us more tools in our toolbox. So I might, in Western medicine, treat a diarrhea case fairly similarly, whether it be a brand new diarrhea case, or a case that has been going on for weeks. Whereas in traditional Chinese medicine, I might have two completely different treatment ideas based on the chronicity of the case. So that's just kind of one example of how we can use the traditional Chinese veterinary medicine idea to look at things kind of actually quite differently. So what to expect from just truly an acupuncture treatment? It's very different horse to horse and condition to condition. Sometimes I have people ask me how many needles you need to treat a horse. Some people might tell you one, and I have seen one needle make a huge difference in a horse. And sometimes maybe we use 40. It depends on the personality of the horse. It depends on the condition that you're treating. So what we start with first is a traditional Chinese veterinary medicine diagnosis. So we check the tongue. We're looking for essentially the color, and then we check the pulse. And when I say check pulse, I don't mean like check the heart rate. We normally feel the jugular pulse, and we're looking for essentially asymmetry side to side, looking at strength, and is it easy to feel? Is it hard to feel? Does it seem kind of superficial or kind of deep? And using that combined with the tongue, we can help make that Chinese medicine diagnosis. So it's kind of, to put simply, we're thinking, okay, is there excess energy? Is there not enough energy? Or is the energy kind of stuck somewhere? That's put really, really simply, but that's essentially kind of the start of this Chinese medicine diagnosis. And then normally we go ahead and do that acupuncture point scan to look for areas of sensitivity. Again, it could be local sensitivity, or we could be finding areas of referred pain. From there, we make kind of a treatment plan, which again, one of the nice things about acupuncture is you can treat so many different things, and you can treat so many different things at the same time. A lot of the points have multiple uses or multiple meanings. So I could use the same point to treat stomach ulcers as I could to treat back pain. So sometimes, and that's why sometimes you can get away with a very minimal needle treatment plan, and still have a pretty broad reaching effect. And the interesting thing that I've noticed in acupuncture, most horses, even the horses that are really, really needle shy, in general, are pretty receptive to acupuncture. You know, I have a handful that won't fall for it, or a handful that prefer the aqua acupuncture to the needle acupuncture, but most are pretty good. The
That
ones
was a question I was gonna ask you, Dr. Billek. We, years ago, we were doing some chiropractic on all the horses in our, acupuncture on all the horses in our barn. And everybody was really receptive. Mine was, I'm gonna go ahead and call him an acupuncture whore. But there was one horse that would begin to get worked up when he realized what was going on. And they had to like sedate and twitch him to get a needle in him anywhere on his body. And
Sure.
I never saw the relaxation and, like, you know, the needles twist themselves out. I never saw any of those signs that every other horse did. So in that case, do you just say, you know what, this particular treatment modality is not for this horse? Or do you say he needs it so bad he should be sedated?
So it really depends on the case. My kind of, we'll call it cheat, has been I have a therapeutic laser that I use. And that's another way to stimulate the acupuncture points. So if a horse is really truly not receptive to needles, normally I can get them to be fairly receptive to the laser. And the benefits of the acupuncture aren't quite as long lasting, but are still there. Other times it's really interesting. You can sometimes put 1 or 2 needles in a horse if they'll let you, maybe in a lower limb or someplace kind of far away from where they're having pain. And if you walk away from them for 5 minutes and then come back, they're receptive to the other points. It doesn't happen all the time. When it does, it's kind of a fun trick. The times that I've sedated a horse and said, I really think this horse needs acupuncture, is in cases of essentially paralysis. So I had a yearling that stuck its head through a gate and ended up with facial nerve paralysis, where it gets one droopy ear, a droopy eyelid that doesn't blink. The nose is kind of turned one direction. And in those cases, we really do need to stimulate the acupuncture points. So I did sedate him to do the electroacupuncture on him to get a good treatment. And the same thing with another horse with laryngeal paralysis, or paralysis of kind of the flaps that open and close at the back of the throat as they're breathing and eating. Those guys I'll sedate, because I do think that they like really medically need the stimulation from the acupuncture points. Every now and then I have a horse that I say, oh, acupuncture just doesn't work for this guy. But as far as from a musculoskeletal standpoint, if the horse will tolerate acupuncture, and even if it is just the laser acupuncture, I think that it makes the medical manipulation treatment so much more effective and so much more long lasting, that it's very, very rare that I'll actually do chiropractic on a horse if I don't do acupuncture on it first. Just because I think it's truly that important. So I've alluded to this a little bit. There's different ways to stimulate the acupuncture points. So you can use the vitamin B12 with the acupuncture technique. You can just use the acupuncture needle. We call that dry needle. Or you can do the electroacupuncture or the laser. We kind of choose them in different situations. Some horses have a strong preference.
Wait, what about the moxibustion?
Oh, yeah, that's a good point. So the moxibustion is essentially kind of a stick, almost looks like a cigar, made of certain herbs. And you can use that in addition to needle acupuncture or alone. And essentially when you're using it, you're either kind of waving the stick over the meridians. You light it on fire, sorry. I did not say that part. But you wave the stick over the points or hold it over the points. Or I actually went to China and learned this technique. People were cutting a piece of ginger, sticking the acupuncture needle through the piece of ginger, and essentially mounting the moxibustion on top of the ginger and setting it on fire on that acupuncture point, but the ginger protected the horse for a really strong stimulation. And moxibustion is used, again, sometimes in horses that don't like needles, in traditional Chinese medicine patterns that normally have something to do with kind of a deficient energy pattern, and is actually really, really appropriate for and successful for like infertility cases. So it's kind of different, it's honestly not something that I use very often. But it's really effective in the cases that it's effective for. But it does smell a little bit like you're smoking pot. So sometimes it sets off fire systems, and so it's something that I don't always go straight to. And then the length of time that we leave the needles in for essentially depends on the horse and the condition that we're treating. You know, I have some horses that let the needle stay in for 10 minutes and wake up and essentially either shake them out or kind of we're relaxing, sleeping, yawning, licking, chewing, and then all of a sudden they're awake and they're kicking or something. And so those are normally like a thoroughbred chestnut mare that does that whole routine. But sometimes I leave the needles in for 5 minutes. Sometimes I leave the needles in for 40 minutes. It depends on the tolerance of the horse and the condition I'm treating. So there's not really a general rule of thumb there. Okay, that was my like really fast crash course. I'm hoping you guys have questions. And if you don't, that's fine. But I'm here to answer them.
Under what conditions would you use the ginger thing or heated needles?
So normally infertility, and normally infertility in a mare, although you could use it in a stallion too. And I didn't get into this far enough because we only have so much time, but essentially when you're looking at that Chinese medicine kind of diagnostic pattern, you're looking at, okay, excess energy, deficient energy, stuck energy, but you're also, there's kind of a heat and cold component too, to each Chinese medicine pattern. And so any pattern that has kind of a cold component to it, which isn't a great answer, but what really comes to my mind is infertility.
Thank you.
Hopefully, can you hear me?
Yep.
Okay, 2 questions. What do you think of the Magna Wave process? I saw at one of the barns putting these loops over. And then Lydia had mentioned about tail pulling. Does that work?
Sure. So the Magna Wave, the technology behind it is PEMF, or it's a pulsed electromagnetic field. The idea behind that is it essentially changes the way that nitrogen and oxygen binds to decrease inflammation and activate healing. So in my opinion, if you're using the Magna Wave once a month or once every 2 months, and you want to do it because your horse likes it and it's a nice relaxing 45 minutes or hour or whatever, then I think it's great. If you're using it as a treatment modality, if you're saying my horse has kissing spine and I want to use Magna Wave or PEMF to treat it, I think it's great, but it needs to be used really, really frequently. So to get, again, in my opinion, and I'm not a Magna Wave practitioner, but to get the results of like the healing effect, you really do need to repeat that pretty consistently. And when I say pretty consistently, a few times a week. The technology is actually really good for things like bone healing, So it is something that, like, if I have a horse that has a fracture and somebody can rent a MagnaWave and use it, you know, once a day, once every other day, then I think it's really effective. There might even be someone in the group that has more MagnaWave experience, but that's my opinion.
Yeah, we have one that came through the chat. Would acupuncture be advised for a horse after it has recovered from severe leg tendon tears with a large amount of scar tissue, specifically superficial digital flexor tendon?
Okay, so let me answer this one before I forget it, and then I'll talk about tail pulse, Rita.
Oh, I'm sorry.
Not
Okay,
forget. So
sorry,
no.
Rose.
So as far as acupuncture goes for something like that, I think kind of yes and no. So I think that if the horse has that severe of an injury, you're definitely getting compensation through the rest of the body, whether that be part of what caused the injury or part of essentially the healing process. You know, if the horse needed to be stall rested or have restricted motion or had time that it was in significant pain from that injury. One, you're developing compensation patterns through the body. The acupuncture and the medical manipulation can help with that. In terms of treating locally, I've had good success with it, and I think it is because of that increased circulation effect and because of the stem cell effect. However, if if you had that significant of a lesion with significant scarring, acupuncture alone isn't all you need. I think acupuncture could be a really beneficial part to a rehab program, but it sounds like that was a pretty extensive injury and you might need a more extensive rehab plan. I don't know who sent that question in, but if you want to give me more specifics, I can try to be more specific with you.
That was Karen Fitt.
Mhm.
The tail pulling. I'm sorry,
Okay.
I interrupted. I didn't realize you had.
No, so the tail pulling, I think, has a couple benefits. For me, I don't normally have people do kind of the tail pull where you stand directly behind the horse and do the tail pull. Some practitioners really like it. The idea behind that is by putting a little tension or traction on the spinal cord and vertebrae, you're kind of helping the horse almost adjust themselves in a way, kind of giving them the space to do that between their vertebrae. I don't think that there's anything wrong with it. I just think for me, it's a little bit more of a pull than I routinely want to put on the spinal cord, especially because of the anatomy of the horse and the way that the nerves go to their tail. I do a lot of side to side tail pulls. So I kind of stand at the horse's hip, grab the dock of the tail, and really gently pull toward me and kind of lean back until I see the quadriceps or the big thigh muscles of the horse engage, and use it kind of as a strengthening exercise. I do that in a lot of horses that had EPM or balance issues or issues standing up or getting down or weakness in their stifle. And I think it's like hugely effective. But in those cases, again, for me, I normally do kind of a longer pull and hold to make it a good strengthening exercise. So like I'll sometimes see people do a tail pull and hold for 2 seconds. I don't find that that's very effective, and I think it kind of puts an undue pull on the spine. So kind of a longer prolonged stretch or pull or strengthening exercise, I think, is effective from a tail pull perspective.
Okay, sorry, 2 more questions. The buddy sour being cured by acupuncture, how does that work?
So again, that guy, we looked at his kind of Chinese medicine pattern and treated the underlying pattern, which for him was kind of associated by feeling like he had a lack of control, which again, I'm putting a lot of feelings onto a horse here, but this is kind of how we look at it from the traditional Chinese medicine standpoint. So he was one of the more dominant horses in the herd, and he was in a big herd, like 10 or 12 horses. And it seemed like he would have pretty significant anxiety, not necessarily associated with leaving one buddy, but associated with leaving the whole herd, because I think he felt like he kind of needed to be there to protect or maintain or whatever, control the herd. And it got significantly worse when new horses came into the herd, and also significantly worse during the season that deer were rutting, and they were really near to a forest preserve. So we think that those were kind of the emotional factors of it. And the nice thing about acupuncture, especially if you're thinking from the traditional Chinese medicine sense, is you can help treat those kind of emotional issues. So what we did with him was an acupuncture treatment with a lot of points focused on 1, calming, 2, decreasing anxiety, and then 3, kind of looking at his overall Chinese medicine pattern. And then we put him on an herbal supplement that actually had nothing to do with calming, but an herbal supplement to kind of help, again, help balance that underlying pattern. And we really haven't looked back. The owner does tell me that if we go longer than like 10 weeks on the treatment, the horse gets a little bit herd sour again.
So you have another question, Rita, and that is unfortunately going to have to be the last one, because we're almost at 10 after 8. So this is probably the longest we've gone in one of these vet Zooms, which is awesome. So let's just do the one more question and then we'll wrap it up so we can all go to bed. I mean, eat dinner.
Roughly, what does it cost for you to come out? I know it's different for each situation.
Sure. So for me, I charge $170 for acupuncture plus chiropractic. If I'm doing acupuncture alone, I charge $140. And the reason, and I don't have a price for chiropractic alone because I literally don't do it. So I try to make it affordable in a way that I can do essentially all of the treatments that I want. So I'm not stacking the acupuncture price with the chiropractic price, because that would end up closer to really $300. I think 170 is essentially encompassing and fair. And then I charge a trip fee. So my trip fee is $60, split between however many horses I see at a barn. If I'm seeing more than 5 horses for chiropractic and acupuncture at the same barn on the same day, I normally waive the trip fee.
Okay, thank you.
Excellent. Really cool.
Thank you, guys.
Thank you so much. Thank you so much
Did
for being
everybody
here,
turn
Paige.
in their email addresses that wants a copy of the handout?
And my email and office phone number are on the handout too. So feel free
Yes.
to reach out.
And
That's
Molly, you'll give me those emails tomorrow or something?
Pardon me?
You'll give me the emails that came in tonight on the chat tomorrow?
I'm going to give you all of them because I know
Yeah.
I know the ones for all the ones that didn't send one.
Okay, okay, all right, great.
So,
Well,
um,
then, I guess we'll wrap things up. Did you have any last minute housekeeping, Molly?
just wanted to say thank you very much, Paige.
This was great.
This was great. And thank you all for coming, because this was a different way of doing it. So we had a nice response. Thank you very much for being here.
Thank you for doing this.
All right, good
Okay.
night, everybody.
cool.
Good
Thank you,
night.
guys.
Thanks, Dr. Billek. I'm gonna email you after this, like probably tomorrow. So.